Hey, I'm here again in the middle of the night. So, my name is Zoom. I'm 19-year-old med student studying at Jalalabad State Medical University somewhere in Kyrgyzstan. What if I told you there was a cure so dark it erased people's minds forever? I stumbled into this horror story and I can't stop thinking about it. You ever get stuck thinking about something so weird and dark that you just can't stop obsessing over it? Yeah, that's me. I dive into these rabbit holes and lobotomy was the latest. So instead of letting it rot in my brain, I am sharing it with you. If I have to lose sleep over it, so do you. Lobotomy, also called leucotomy, was a type of psychosurgery developed in the 1930s aimed at treating severe mental illness by cutting connection in the brain's prefrontal cortex, the area responsible for personality, decision making, and social behavior. The theory was that disrupting this brain's pathway would calm patients suffering from schizophrenia, severe depression, or obsessive behavior. But here's the catch, nobody really understood how the brain worked back then. So, the solution, literally poking around in people's brain with the ice picks or sharp instruments, sometimes through the eye socket without even opening the skull properly. Yep, no fancy tools, just a sharp object and some hope. Procedure was first developed by Portuguese neurologist Antonio Egas Moniz, who won a Nobel Prize in 1949 for his work. Yes, a Nobel Prize for lobotomy. But his original method was invasive and risky. That's when an American doctor, Walter Freeman, popularized the transorbital lobotomy, a quick office-based procedure using an ice pick through the eye. Freeman performed thousands, sometimes multiple a day. He even created the Lobotomobile, a van to reach the patients in remote places. The results were unpredictable. Some patients became calmer but lost their personality, creativity, or ability to feel emotions. Others were left with paralysis, seizure, or worse. Many patients became permanent wards, unable to speak, walk, or care for themselves. And many had no say in the matter women, minorities, institutionalized peoples, even children's. One of the most heartbreaking cases was Rosemary Kennedy, sister of US President John F. Kennedy. After mood swings and learning challenges, her father authorized a lobotomy without telling the family. She was left incapacitated for the rest of her life, a shadow hidden away from the world for decades. By the late 1950s, lobotomies declined with the rise of psychiatric medicines like thorazine. The public and medical community began to see lobotomy as a brutal, inhuman practice. And it was. Turn out, destroying parts of your brain isn't a good treatment plan, but the legacy remains a reminder of how desperation and ignorance can cause immense harm in the name of science. It's not just history, it's a warning about how we treat the vulnerable, how easy it is to accept science without questioning, and how deeply human can suffer. I overthink, I feel deeply, I needed to say this out loud, which is why you are here now, my free therapist. And if you are still here, thank you for listening, for being curious, and for not clicking away. Hit like if your brain is still intact. Subscribe if you love weird history, and tell me what's the creepiest medical story you know. And remember, sometimes the real horror isn't fiction, it's what you call science.